Hello again, everyone. My name is Marty Guthmiller, and I'm the CEO at Orange City Area Health System. Welcome to the 32nd edition of our COVID-19 community briefing. The last briefing was 4 days ago on June 25. So we'll provide some updates from the 25th, and I'll refer to some statistics from 4 days ago as well. Before I begin with some of the stuff that we typically report, I would just like to say that we are continuing our mandatory screening of all of our staff at all of our sites in accordance with the governor's proclamation that continues. And we are continuing with masking, not only in our senior care universally, but also throughout the health system, when it comes to patient and provider contacts. So that's just a little bit of oversight that a lot of things are just continuing as is. And the screening and masking is certainly one of those. Now to our statistics. And first of all, we'll start off with the local scoreboard. We have had 43 positives here at the health system of 622 tested. That's a positive rate of 6.9%. So that percent positive has dropped below the 7% line. Now we do have 24 tests pending, but like we've said in the past, none of those are particularly concerning. Most of those involve our pre-surgical testing. At the Sioux County level, we've had 446 positives out of 2,810 tested. So we've tested 1 out of every 12 Sioux County residents at this point. The testing rate, positive rate, is dropping as well. Not very quickly, but it's at 15.9%. That's down from 16.3%. But good news in terms of that rate declining. Region 3, the 20 counties in northwest Iowa, currently have 31 patients hospitalized with COVID-19. That number is down from 36. So good there. There have been 5 patients admitted in the last 24 hours. So there's still active acuity levels out there. 7 people remain in our ICU in Region 3, and that's down from 12. I think I read there's something like 84% availability of ventilators in Region 3. So obviously there's lots of capacity at this point, but good news, 7 ICU patients as opposed to 12 in just 4 days ago. In Iowa, on a statewide basis, we have 28,699 positives of 299,986 tested. So nearly 300,000 Iowans have been tested. That is a 1 out of 11 rate. And the test rate positive is 9.6%. That's down from 9.8%. So remain below double digits at 9.6% as a statewide basis. Again, as our seasoned viewers here know, there are a couple things we look at, that I look at, and that's the positive rate and also the hospitalization rate, because that's one indication of the acuity level, how sick people are getting. Hospitalizations in our area, in the state, first of all, are 125. That's down from 131 4 days ago, which was down significantly, like 50-some patients down from the time before that. So we're at 125. Sioux, O'Brien, Lyon County are all at 0 hospitalizations. Plymouth County has dropped to 2. Dickinson and Clay County are both at 0. Woodbury County is 18. That is actually up 1 from 17 the last time we talked. Polk County is down to 21 from 29 4 days ago. And BV is down to only 4 at this point, which is down from 6. So it appears as though the worst might be over relative to BV County at this point. So good news on the hospitalization front, which I interpret as good news on the acuity level front as well. With that said, we still have an increase of deaths in the state of Iowa from 694 to 707. So 13 patients, 13 residents or citizens of Iowa have died since just 4 days ago. So this is still serious. This is still out there. We're in mile whatever of the marathon. Again, this is a marathon and not a sprint. So some good news with those things, but it's still real, very real. I want to shift gears just a little bit and talk about something that we're going to be offering locally here, and something that may be of interest to you, and it involves serology testing. This is a blood test. It requires a blood draw, but the serology testing is for the antibody, that the COVID-19 or the coronavirus antibody. This basically is a test that shows whether you have antibodies and presumably have had COVID-19. Again, we can't predict that you are immune or how long the antibodies may be present, but we will be able to offer that test here soon, and I'm going to give you the details for that right now. We do have our own equipment now for serology testing, and so we will be doing that test in-house and can give those reports quite quickly, actually. So we will be opening this public testing of serology or IgG testing up to the public beginning on Monday, July 6th. It will be offered from noon until 4 p.m. and will be offered at our walk-in clinic site, which is in the Holland Plaza Theater area there. So beginning noon to 4 on Monday, July 6th, at our walk-in clinic. You can just show up, ask for the IgG test. This is a $60 cash test. It will not be filed with your insurance. Insurance filing does require a diagnosis, and so while that might be possible, you do have to have a relatable diagnosis for insurance to cover this test. So at the walk-in clinic, this will be a cash basis test to determine whether or not you have had you have the antibodies. Our staff will also make sure that if you're a patient of ours, or maybe even not, that you get signed up to the MyChart. MyChart will be beneficial and helpful in this process, and it also will get your results immediately as soon as the results are available. So you'll get a text through MyChart that will give you the results. So if you haven't had that, our staff will help you sign up with that. Again, if you're one of our patients, it will be recorded in the patient's chart. You'll also get a mailed copy. If you're not one of our patients, you're still welcome. But obviously we don't have a chart for you, and so you will be mailed a hard copy of that result as well. So again, serology IgG testing for the coronavirus antibody will begin to the public on Monday, July 6th at noon to 4 in our walk-in clinic. We'll get more information out too in the days ahead on social media, but we wanted to get that out today. There'll also be more news in the very near future about the ability for us to be doing our own PCR or the swab test locally as well. We will have our own analyzer. We will be able to offer that test here locally, particularly as we gear up for this fall with schools opening. We think that's going to be one element that may be beneficial, but we'll be able to do our own testing here, and we'll have more information on that in the very near future as well. I want to remind everybody of the 6 feet, 15-minute rule. To try to stay at least 6 feet away from people, to not spend more time than 15 minutes within that if you have to. That's how the CDC IDPH defines an exposure. Use common sense with all of that. Remember grace, extending bilaterally at this point, particularly regarding mask wearing. you talk to different people and you hear different things about mask wearing. Mask wearing is important, but particularly remember the 6 foot and 15-minute rule, and continue to avoid large groups, control what you can control, but live your life. We need to get on with life. We need to live our life, but we don't need to necessarily live it recklessly. And so if you do the 6-15 rule, you wear your mask when you can't you can't avoid those things. That's probably the best we can hope for at this point in time. And use grace. You don't know what's going on with another person, and so we just offer that as well. So as I close, I'll just remind you with our little recommendation that we have, our encouragement that we have to stay vigilant, to stay strong, and above all, stay healthy. Thank you for joining us, and we'll look forward to presenting more briefings in the days ahead. Thank you.